wondering what's the difference between radial shockwave therapy and massage guns that you have at home? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you the big differences between radial shockwave therapy and massage guns. So the first big difference is radial shockwave therapy uses radial shockwave energy. So what you'll see in this handpiece is there's actually a little bullet that sits in there and it'll shoot up and down in that shaft. It hits that metal piece right there, and generally what we would do is to hold that over the muscle belly that we're trying to treat. Nothing is pounding on you, rather the little lead bullet is pounding on that metal piece, and that on your skin is creating a radial shockwave effect. That goes through the muscle belly, and studies have shown that radial shockwave therapy helps to promote healing in the soft tissue. It reduces the inflammation, it actually reduces the swelling, and it helps the tissue to form new healthy cells, and therefore helps you recover from your injury and helps you get back to active living sooner. There are actually different heads that will go to different levels of the muscle. So that's the most shallow one, so it will work on the very superficial muscles. There is the medium one here that would work a little bit deeper. So if we think about back muscles that need to be a little bit deeper, a little bit tighter, that needs to be worked on. And then there's the really deep one that will work into really deep muscle belly. So if you think about gluteus muscles, so muscles in the buttock area or in the thigh, depending on how big the muscle bulk that you have. So it works specifically, it has different frequency, it can go into different levels of muscles and different intensity to get that outcome for you. Massage guns, on the other hand, uses mechanical energy. So it's that pounding away. And you know, if anybody was pounding away on your muscles, it would release the muscles. However, I'm not too sure if there's actually studies to say that that would trigger the physiological reactions for soft tissue healing, for healthy cells to regenerate, and to reduce your inflammation to help you overcome your injury. Sometimes using those massage guns, and depending on who you use it on, if their muscle bulk is small or their bone structure is frail, you may actually end up causing more damage than good. The other big difference with radial shockwave therapy is it needs to be used by someone who's a trained medical profession, so like a physiotherapist, because the therapist actually understands the anatomy of muscles and to understand the cause of your injury and is able to target where we should treat with radial shockwave therapy rather than just using a gun like the massage guns, which don't need any training, and it's literally, you know, go for it wherever you think the pain is. So it is really classified a medical piece of equipment, and it shouldn't be used by anyone who's not trained in using it. Studies have actually shown that radial shockwave therapy is extremely effective for reducing spasticity or increased muscle tone in people with cerebral palsy. It works on people who've had strokes as well, because all that increases the muscle tone in their arms and legs. And radial shockwave therapy can actually reduce that tone to allow people to move their hands and legs better, to walk better, and to be able to function better. So there's a big difference between the massage guns that you might find at home versus the radial shockwave therapy machine that we would have in our clinics. So if you are out there and you're wondering, would radial shockwave therapy help my soft tissue injury? Why don't you ring us here at My Favorite Physio, speak to one of our expert physiotherapists. Find out if radial shockwave therapy is the thing you need for your soft tissue injury. The number to ring is 02-9790-4233. And if you know somebody out there who's actually nursing a soft tissue injury, and no matter what they do, they seem to not overcome it effectively to get back to active living pain-free, why don't you like and share this video with them? Until next time, have a great day. Bye.